Have you ever noticed a person who does some actions that do not make any sense, or a person who usually does some nervous rituals to feel satisfied? Well, these people may suffer from a psychological condition, a condition that can influence their social life, a condition that chases their thoughts, a condition called obsessive compulsive disorder. Obsessive compulsive disorder, or OCD, is a condition when a person believes in a certain idea and be persuaded with how silly is this idea, but he or she can't stop thinking about it because the mind plays the role of a bully and gives orders to the person to do some irrational actions repeatedly, and if the person didn't do these actions, he or she will feel guilt and worried. And it has two main symptoms. The first one is obsession, which is the unwanted thoughts, and the second one is compulsion, which is the repeated actions that should be done to stop anxiety. A person can have OCD because of an emotional shock or a genetic reason. Over 1 to 3% of humans from any age have OCD, and usually they have the same symptoms. One of them is being afraid of germs. Now, of course, we all have to wash our hands many times a day to keep them clean, but we shouldn't exceed the limit. Washing hands over and over because of the fear of germs is one of OCD's symptoms. Another one is double-checking certain things many times, like checking the stove or the door. Also, some people have mental rituals like counting in their heads before opening the door or counting their steps. These people understand that their behaviors do not make any sense, but they find a difficulty to get rid of them because of their thoughts, and their motive is often to make things safe. Chad is 35 years old. He does OCD rituals to get rid of the bad luck. He counts everything he sees or does. These actions are a response to anxiety because he fears that if he doesn't perform his rituals correctly, something bad will happen to him or his family. He sometimes spends about 10 hours doing these rituals, and that cracks him and leads him to madness. Wendy Johnston is a mother for 2 children. She aborted 1 child before, and that caused her an emotional shock. After a while, she started to arrange her house, and she kept doing that many times because she felt satisfied and comfortable. When she thought about that, at once she realized that she had OCD. The OCD had developed with her to a higher level. She couldn't touch anybody, even her husband or her kids, and she feared from touching anything shiny. So, she was taken for 9 days to a special house with 2 persons who have OCD and some doctors to help them. They have been supporting each other until they defeated a small part of their fears. But they have to continue fighting OCD in their normal lives. In Islam religion, there are some thoughts that come to Muslims' minds that make them doubt their performance for praying. Like sometimes they think that they didn't wash up properly for their prayer, or they think that they missed something while their prayer, although they realize that they have done both of them correctly, and as a result of OCD, they keep repeating them until they feel satisfied. As a personal experience, before several years, I used to wash my hands 5 times whenever I use the bathroom. And now, I double-check the electricity keys are turned off and the stove is off too. OCD can be cured by some medicines like any other condition, or by a psychological treatment to stop the person of doing the action again. And that can be done by a doctor or sometimes a family member. Remember, OCD is a condition that needs a strong refusing for silly ideas. So, be aware of entering the OCD complicated net.